Good afternoon. My group and I will be talking about the disorder ankylosing spondylitis. My name is Savanna Sadowski.
My name is Wesley Chung.
And my name is André Lagron.
Definition and cause of the disorder. So what is ankylosing spondylitis? AS is an autoimmune and inflammatory disease that causes arthritis on the joints and ligaments on the spinal column. AS is sometimes also known as Bechter's disease. Being a chronic and progressive disease, the first major sign and symptom of AS appears in the sacroiliac joints where the spine connects to the pelvis. This first sign of joint inflammation eventually spreads to the rest of the vertebrae and to other ligaments, cartilages, and even organs throughout the body. On the vertebrae, the disease attacks the small joints that make up the spine and fuses them together, making the spine less flexible and transforming its healthy S shape into a hunched forward position. Back pain and pain in the buttocks region are common and become more widespread as the spine becomes more stiff. Sleep, rest, and long periods of inactivity contributes to the feelings of stiffness on the back. Aside from the effects on the spine, the progression of AS appears in ligaments and joints of the shoulders, hips, soles of feet, heels, and the rib cages of chest, which also contributes to the difficulty of breathing. Very rarely, organs such as the heart and lungs are affected, as well as the eyes, in which the eyes become inflamed which causes eye pain and sensitivity to light. Neurological complications also occur, such as reflexes in urination control and bowel movement due to pressure on the spinal cord. Normal reflex activity in daily life may even be compromised. AS is dangerous as the primary inflammation on the spine and pelvis leads to progressive deterioration of bone and organ structures of the whole body, causing potential secondary symptoms such as declining neurological reflexes, breathing, eyesight, and other underlying compromises to the body functions to occur. Next slide. So, what causes AS? Unfortunately, scientists and doctors haven't figured out an identifiable cause of the disease. Usually, environmental conditions are potential reasons for the development of AS. However, it is known that AS is genetic based as it is prevalent in family histories. It has been identified that the individuals and family members that carry the HLA-B27 gene develop a greater risk at developing the disease. Therefore, HLA-B27 is responsible for the biological pathway that causes AS. People with the gene that are positive for AS aids white T cells to attack not only foreign particle that poses a threat to the adaptive immune system, but the immune system itself. Its detection of the bones of the spine as a threat causes the T cells to attack it on site. Andre will go more in depth on how the gene works.
All right. Now we'll be talking about inheritance, diagnosis, and treatment. Next slide. So the inheritance of AS has been shown to be an autosomal dominant genetic disorder, although the exact genes have not been specifically determined. As we can see in this pedigree, black indicates individuals with AS, and each individual on the pedigree is marked with their status in relation to gene HLA-B27, as a link has been shown between this specific gene and higher risk for AS. Next slide. So individuals with the HLA-B27 gene, which is found on chromosome 6, have been shown to have a higher risk for AS, as well as a number of other autoimmune diseases, although not all people with HLA-B27 develop AS and vice versa. The HLA-B27 protein is an intermembrane protein that serves as part of the major histocompatibility complex. As you can see from the structure, the series of alpha helix structures allow this protein to span the cell membrane by hiding the polar backbone of the polypeptide chain. HLA-B27's intended role is to help the immune system identify foreign objects in the body and activate an immune response. However, it, in the case of ankylosing spondylitis, does indicate for the immune system to attack the spine instead. Its intermembrane location helps it to send signals to and from cells by acting as a membrane-bound receptor protein. Interestingly enough, though the human lymphocyte antigen B27 does increase risk for AS and a number of other autoimmune diseases, if individuals have HIV, a statistically significant number of individuals who have HIV and HLA-B27 have shown significant resistance to HIV over an extended period of time. So there's an interesting irony there that while this gene does increase risk of some autoimmune diseases, it defends against a virus that leads to others. Next slide. Unfortunately, AS is very difficult to diagnose because the genes that code for it, again, haven't been specifically figured out. In addition, because the major indicator for AS is back pain, which is prevalent in a great many other disorders, and could even just be the chair that you're sitting on at work, it can be difficult to identify the disease at those critical early stages before the spine has fully fused. Usually a combination of MRIs, blood tests, and x-rays, as well as knowing family history and symptoms, have to all be combined in order to give a diagnosis of AS. And in order to find those, family history, genetic counseling can be very helpful in determining a person's individual risk factor. Next slide. Next slide. Back one more, sorry. Yes, unfortunately, much like the diagnosis, there are not a lot of options for treatment. There are some prescription medications that will reduce inflammatory response, but they can cause a lot of other side effects, including stomach bleeding and heart problems. The specific non-steroidal anti-inflammatory drugs, they suppress the inflammatory pathway by inhibiting the COX-1 and COX-2 enzymes, preventing them from sending out signaling molecules to induce inflammation. In reality, the most common and cost-effective treatment is physical therapy and exercise, though exercise is certainly the more cost-effective of the two, both of which can help slow the impact of the disease and aid in pain management. All right, next slide.
Statistics of people likely to have this disorder. Next slide. Groups that the disorder is more common on. There is not yet an identified cause for the disorder ankylosing spondylitis. However, there is a positive association with individuals that are positive for the gene HLA-B27 and the disorder. Ankylosing spondylitis is more prominent in white males in the age range of 16 to 35 years of age. In the United States, the gene is 3 times more notable on white Americans, with 8% being HLA-B27 positive, compared to African Americans only being 2 to 3% positive for the gene. Next slide. The paper we chose was studied at the University of Washington by the Orthopedics and Sports Medicine Department. We learned that the disorder is hereditary, and 1 in 5 individuals with ankylosing spondylitis have a biological family member who is also living or will develop the disorder. In addition, 80% of individuals who are positive for HLA-B27 will not develop the disorder. Less known is the correlation between the spinal disorder who also have psoriasis, which is a skin condition, although researchers are still studying the relationship between both conditions. Ankylosing spondylitis can have a negative effect on the aorta, the vessel that transports the blood from the heart to the rest of the body, by causing it to inflame and ultimately disrupt the normal transportation of blood. This concludes our presentation. Thank you.